Good evening, everyone. Today's session is going to be really helpful, and it is led by Dr. Didi Verma from Apollo Cradle and Children's Hospital. So stick around. She's going to talk about fibroids and its symptoms and treatment. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Okay. Good afternoon, everyone. So today we'll discuss about the fibroids and the symptoms which occur due to these, and later on treatment part, right? And in between, if you anybody of you is having question, you can write it or you can ask in between as well. So fibroids, these are non-cancerous tumors of the uterus, and they are very common. Around 4% of the patient they are suffering from 40%, right? From the in the reproductive age group, 15 years to 45 years, you can say. And if randomly one is doing ultrasound of the pelvis or uterus, for around about 4 to 5 of them will be having fibroid. And if we can discuss about the symptoms, they depend upon the size of the fibroid and the size and site of the fibroid. And the uterus is having three lines, right? Endometrium, there is the wall, and the outside of the uterus. If these fibroids or leiomyomas, they are in the endometrial cavity room of the uterus, then the symptom will be menorrhagia, heavy bleeding, prolonged duration of bleeding, or sometimes bleeding or spotting in between the periods. If they are in the uterine wall, intramural fibroids, then the symptom will be different, like dysmenorrhea. And if the fibroid is large, then pressure symptoms can also occur, heavy bleeding, and rectal, yeah, bowel symptoms, as constipation or something. है ना? And if they are outside, sometimes there is no symptom at all, and patient is asymptomatic. And these asymptomatic fibroid, they never require treatment. If they become very large, like more than 6 centimeter, or there are some pressure symptom on the bladder or bowel, then later on we can remove these depending upon the uh, size or these things. And they are non-cancerous tumors or neoplasias, and then rarely they result in the sarcomatous changes, which is the cancer of these fibroid, which is very, very, very rare. है ना? And if we can, and sometimes if the fibroid is occupying the or distorting the endometrial cavity, then there are chances of the infertility or subfertility as well. And if we can discuss the diagnosis part, what we can do, we can go for the diagnosis of this state. Yeah, symptom ke sath patient is coming, we can go for the ultrasound, or if it's a large fibroid, we can also go for the MRI as well. Now, treatment part can be medical. If there are no symptoms, then there is no treatment required. And if at all there are symptoms or something, depending upon the symptom, we can go for the treatment. Like normal small fibroid, we can go for the medicines like Dynogest or Fibrostone, है ना? Or we can also go for the other symptoms are only pain, slight pain, we can give painkillers. Or if symptoms are like menorrhagia, simple bleeding is more than the normal, but regular, then we can go for the other treatment medicines. Or sometimes if they are small fibroid in the uterine wall or outside the uterine wall, we can go for the intrauterine devices as well. But if there are symptomatic fibroid, patient is suffering from menorrhagia, heavy bleeding, clotting during periods, है ना, dysmenorrhea, or subfertility, we can go for the myomectomy, which can be done laparoscopically by robotic or through the hysteroscope. If the fibroid is small, like less than 3 centimeter, and into the uterine cavity, then we can go for the hysteroscope and hysteroscopy resection of the uterine fibroid. If they are large fibroid, we can go for the myomectomy. And if patient's age is more than 40 years and there are multiple fibroids, patients suffering from this thing, we can also go for the hysterectomy sometimes. or if it is causing infertility or something, myomectomy, and then we can remove the fibroid and save the uterus and uterine wall. To strengthen the uterine wall, we can stop the period for 6 months or so, and later on patient can conceive and can be delivered, right? And sometimes whenever if the fibroid is become very large in short period of time, or there are other symptoms, loss of weight or something, then we can consider that there are some changes, sarcomatous changes in the fibroid, and then we have to remove the uterus and the around surrounding structures like tubes and ovaries, and which is very very rare. Okay, and if at all you are having some question regarding fibroids, you can ask, you can write it to the hospital. Okay.